And I'm Elisa Bokeen, and we are two brown chicks changing the face of therapy on both
Both sides
sides of
of
the
the
couch.
couch. Welcome, welcome, welcome. We have another wonderful guest. I'm so excited because I feel like this season of us like getting back into the podcast and all of that, we've had some really dope guests. And so we're excited to have Shivonne Odom of Acoma Counseling Concepts. Is that correct?
Yes.
Wonderful. So, Shivonne is a licensed professional counselor. She is in DC, Washington, DC. She's also a national certified counselor in the state of Maryland, as well as a national certified perinatal mental health therapist. And she is here today. We're going to be talking about Black maternal health. And we are so happy to have you here, Shivonne.
I'm excited to be here. I'm excited to be here.
One of the main questions I had, I think, I'm pretty sure, let me not say that. I looked it up, but I wanted to make sure. May is Maternal Mental Health Month, correct?
Yes, it is.
Okay.
Yes, it
Okay.
is.
So I was right. Just making sure. So I'm curious, like, what is maternal mental health or perinatal mental health? Are those different? Are they the same? How do you know if you need a therapist that specializes in this?
So perinatal and maternal mental health, yes, they are one and the same. What is it? It is counseling that is specifically focused on perinatal mood and anxiety disorders like postpartum, the most commonly discussed one, postpartum depression. But there's also other perinatal mood and anxiety disorders like postpartum anxiety, postpartum obsessive compulsive disorder, postpartum trauma, PTSD, which we hear a lot about in this Black maternal health crisis. Um, and then the one that we see in the movies that really doesn't happen that much, it's like an occurrence of 0.005 nationally, is postpartum psychosis. The other type of perinatal mental health disorder that is not openly discussed are those that unfortunately suffer from perinatal loss, like pregnancy loss or a postpartum infant death or a stillborn death. So because a pre-qualifying factor for the DSM diagnosis is peripartum onset, and you can only have these diagnoses from the time of conception all the way up until the infant is up to 1 year old. And that's also separate from reproductive psychotherapy, which I also specialize in, where we are talking about mental health issues or stressors pertaining to trying to conceive and infertility issues.
I love how you broke all of that down, because I think so often we just hear the term postpartum depression, right? And knowing that there is a lot of variances, not just post partum, but even prior, like, and even during pregnancy, right? Like, and so how I think one of the things that often people talk about is like the baby blues. So what would you say is the difference from, the baby blues versus okay, let me try that again. And Ebony, I accidentally muted you. But I think you can okay. All right, let me try again. So what would you say is the difference between, let's say, the baby blues and perhaps postpartum depression? What should individuals know about that?
I'm really glad that you asked that question because oftentimes the two get confused. And so the baby blues, 80% of all birthing women in the United States suffer from symptoms of the baby blues. It's not it's not a clinical diagnosis. So it only happens up until 2 weeks up until delivery. And what that is like, especially for first time moms or moms that thought that they had it down with one or two kids and now they have a third or fourth, right? Is your hormones are changing and your body is recognizing like we're not pregnant anymore. And so now we are lactating. Now we're sleep deprived because this life that you were growing inside of you is now outside of you, and you can hear their cries and you can also see their needs. Um, So that's really what that difference is. And then postpartum depression, just like all the other perinatal mood anxiety disorders that I had described, postpartum depression is also called prenatal depression, for like when you're pregnant, is you're experiencing these symptoms for about 4 weeks or more now. And so you're just feeling this level of tiredness that doesn't seem like it's going to go away with any level of sleep. Um, Sometimes you may feel like, oh my gosh, I don't know why I don't feel attached to my baby. I don't know if my baby feels attached to me. Another huge indicator for postpartum depression is guilt, and shame. A lot of the moms that I counsel, they express guilt about feeling these feelings of sadness and depression. And that's one thing I really want for people to understand is it does, these women are not feeling great when people are saying you should be happy. No, they actually feel really guilty because their body is going through these changes that they have no control of, and it's causing them to have difficulty sleeping that's not related to the infant schedule. So they can't sleep when their baby is sleeping. They're also having difficulties with appetite, which can be extremely stressful if you're choosing to breastfeed your baby. Then again, that's another risk factor for postpartum depression is if you're having breastfeeding and latching difficulties, right? And cannot begin to tell you, like I've had clients come to me for counseling because they have overproduction of milk and they feel embarrassed about that. And then I have clients that come to me for the fact that it's like, oh my gosh, my baby can't latch, but I'm able to pump pretty easily, or I'm not able to express milk at the level that my baby needs it. Those are other risk factors for postpartum depression. And then this irritability, postpartum depression can really, really test a lot of romantic and familial relationships. Um, so I don't even really see mood swings with this population. It's just sadness, depression, irritability, and sometimes anger. Some of the most depressed clients can express as the most angry. Um, so yeah, and it's just this feeling of hopelessness, like, oh my gosh, this is me now. These symptoms are never gonna go away, and I'm so embarrassed. What is wrong with me? I'm not even designed to be a mom. I don't even know if my kids should even have me anymore. And to an untrained ear, somebody would think, oh, this woman is suicidal. Do we need to call Child Protective Services? But for a clinically trained ear, we're hearing those factors of guilt where the mom actually has some self recognition that these feelings are not okay. And so I really need some support and help with this.
I
I really,
wish
yeah.
I was
Go
gonna
ahead.
say I wish I knew all of this when I had, because so I have 3 kids, and my last one, a lot of what I'm hearing from you, and it's like, oh, it's clicking more and more for me, is that we have certain expectations that are placed onto us or that we place onto ourselves. And I do think that pregnancy and childbirth and being a mom, like all of that, being a parent, all of that is so romanticized in so many ways. And I remember the same thing with my daughter. She had colic, and so she was not sleeping. So I was sleep deprived. I had 2 other little ones, 6 and under. And I suffered from postpartum depression and anxiety. And I do remember that part of what I felt was a lot of shame, because I felt like I know when I went into it, I was like, I know what I'm doing at this point. I know how, what to expect during pregnancy. And so a lot of what I'm hearing also are just some of the roles or some of the ways that the experiences that we think we're supposed to have, and when we don't have that, and then we're sleep deprived, and just always remembering that every experience is different. I don't know why I didn't go to therapy back then. But I love that we're having these conversations for individuals to know that there are people out there that can support you through this.
Yeah, that's actually the reason why I chose to go into this.
What you said earlier around having a trained therapist, right? I think is what's really important, right? Because when someone is presenting a certain way, if they are not trained, what they may see will be completely different, right? And I appreciate the fact that you pointed that out.
Yes, yes, thank you. So thank you, Eliza, for saying for mentioning like your experience. I like to believe that while perinatal mood anxiety disorders have been around forever, the field is actually fairly new, right? And so I actually chose to get into this profession because I didn't see clinicians that looked like us. I didn't see perinatal mental health clinicians that looked like us. Period. I just didn't. And then the ones that I did see, there were still few of them, right? There were still few of them. So even if there's a perinatal mental health clinician that's not a person of color, there's still very few of them. And in this region, very few of them are credentialed with insurance, which is another barrier. And so, and then also to kind of touch on what you were saying, Ebony, is just I just forgot what you said, but in any event, that's the reason why I chose to pretty much come into perinatal mental health, is because I just was like, wow, everybody's getting counseled, the kids, the partners, the friends, and no one is thinking that this woman needs to be counseled. Like, her whole body has changed, her financial situation has changed, her job situation has changed. We exist in an environment that expects working moms to exist as though they're not moms at work, and so that's also a psychological transition in itself.
That's such a good point. That is such a good point. And I think you are you're right. There's been so many changes, and I think a lot of women, like what I did was I went to my OBGYN, right? Like and told them about what was happening, but I really think the benefit of being able to process with a therapist, I mean, that's priceless. One of the things that, as we're talking also about the perinatal care, is that research has shown that Black women in particular have a higher chance of having preterm births, whether that's spontaneous or whether it's recommended by a physician. So, we would love to hear what your thoughts about what's going on with that. Why are Black women at more risk of having premature babies?
And also, in correlation, we also have the highest rates for having a perinatal mood and anxiety disorder. So the national rate is one in every seven women, and for African American, it's one in every three. So if you know eight
Wow.
moms, you
Wow.
know somebody that's had a perinatal mood and anxiety disorder. Um, and that's really not talked about. And I thank you for asking about why do we think that these preterm births are having, or things maternal, like maternal morbidity, where moms are passing away due to childbirth complications. Um,
Right.
I think it's a lot of things, and this is why I love being a perinatal mental health clinician. One is we're not listening to Black women, right? And this is why a perinatal mental health clinician is important. It's somebody that can help support this mom of color be able to feel comfortable with her uncomfortable feelings, and also help guide her to the appropriate birth professionals to help her advocate for herself. Um, and also to touch on, I now remember what I wanted to say, Ebony. Thank you for mentioning the importance of being trained, because I've seen clients that have come to me that have seen clinicians that are not trained in perinatal mood and anxiety disorders, and they've unfortunately had really bad interfaces with the legal system that they really shouldn't have had. And so again, that also
Mm.
lies it also contributes to the rate of maternal mortality that we're seeing, is again that mistrust of those systems. Also, I'll use where I live for example. So I live in Ward 8 in Washington, DC has 8 wards. Ward 7 and 8 have one of the highest concentrations of African American individuals. This is significant because Ward 7 and 8 has no hospital with a labor and delivery unit. So that's very scary. So, for those that are
Wow.
listening, what that means is that there's no hospital within a 10 to 15-mile radius that a person can deliver a baby. So, you go into labor, and especially if you're high risk and you're
Goodness.
not adhering to case management that's following up, that also puts you at risk. There's also a small number of Black midwives available nationally. So again, that also goes with the systems of trust, right? I believe studies show the same for healthcare, the same as mental health care, that when individuals see clinicians that look like them, right, they're more likely to adhere. But we're having these rates, one, because as I made in a recent Instagram post, that unfortunately we are heavily relying on the systems that we don't trust, which is the medical system. We're using the emergency room and our OBGYN and our PCP to do oh yeah, they looked over me, but they're not the ones that can actually do your ultrasound. They're not the ones that can do your reproductive health and fertility workup, that can be able to tell you whether you have blockage in your uterus or your fallopian tubes, that can be able to tell you how many fibroids you have, what stage of endometriosis that you have. And so what happens is we have a lot of individuals that are walking around with pre-existing conditions that never got the intervention that they needed because they're heavily relying on these systems. And we're also viewing support workers like doulas as luxuries, and when they're really not. These are really things that are going to save us. And studies show, and even the DONA website, DONA International website, the National Doula Organization, they also support and state that um, birth rates, successful birth rates, actually increase when you have the presence of a doula. And I highly encourage every woman of color that um, if you want to make sure that you're trying to add some level of security to your birthing experience, hire a doula. Here in the DMV, Maryland, and DC specifically, we have something called the Black Doula Project, which allows residents of Maryland and DC to apply for a grant towards having a doula of their choice. Um, Pretty much provide support to them. And again, these are things that can reduce rates. Also, and why? Because again, a lot of people confuse doulas, midwives, nurse practitioners, and obstetricians to be all one thing, and they're not. Your doula is your advocate in the birth and delivery room. Your midwife is somebody that actually reduces your rate of C-section. They specialize in vaginal birth. They do not conduct C-sections. That's another thing that's important to know. We're in the midst of a national C-section epidemic. We have a rate of about 40% of all births in this country are delivered by C-section. So if your doctor ever tells you things like, "Oh yeah, I'm going on vacation, so let's just induce you now," no, your doula is going to be the person who's going to advocate for you. That's going to say, "No, this isn't medically necessary because you have to go on vacation." No, like, we need to let this baby bake some more, because the longer this baby stays in utero, the healthier this baby is. So I know it's just long winded, but that's pretty much that. And then also, again, the stigma associated with mental health. Um, I We have a lot of clients that sometimes, even though they're referred to as via a care manager through their insurance, they just don't have the best adherence rates and follow up rates, even with all of the supports, due to multiple different barriers. And again, that also contributes to these maternal mortality rates. One hospital I will not mention, they deliver the largest number of Black babies in the state of Maryland. Everybody that's listening in the birthwork community in the DMV knows exactly who I'm referencing to. And they're advanced religious institution, so they use religious directives to be able to make decisions on whether a mom can have a potentially life-saving procedure or not. On top of that, they don't allow midwives.
Wow.
So you are going to see higher mortality rates because you're having less holistic supports, but you also have individuals coming in there varying religions or no religion at all, in which one religious view is being used to render services to moms. And then also, some states don't have a maternal mortality review, where people by law are forced to actually evaluate, why are these deaths happening. I unfortunately have had the experience of a client dying after delivery in their pediatrician's appointment 2 months after.
Oh,
This was not
oh
their
my
first
goodness.
child that they had. They had a few children prior to this delivery. So this is real. This is very much real, and it's not a socioeconomic status thing. It definitely is. It definitely is a race thing.
And I'm so glad that because what I heard is systemically what's happening, and also the stressors, right, that Black and brown folks face on a day to day, and how
Mm-hmm.
that impacts our mental health, and of course our mental health impacts our physical health. And I
Mm-hmm.
think it's so important to highlight that, because a lot of the times I think people can take this research or these studies and turn it around and blame the individuals. Well, what are you doing that's causing this? And so I think it's so important to highlight that, no, this is a systemic issue. This is also something that is impacted by racism, right? And by the way that individuals are treated, Black and brown folks are treated when they are in the medical system.
Yeah. Yeah. part of me, as you were talking about the mortality, and I know Lisa mentioned like having postpartum depression and anxiety, my thought went to like the people that are now developing anxiety or have anxiety around getting pregnant, having babies, and things like that. And so I was curious, like in your practice, I know that your specialty is perinatal mental health, but do you get people that maybe haven't even gotten pregnant yet that are still like, I don't even know if I want to because I'm fearful of having a child, even though I've always wanted to be a mother?
Absolutely, absolutely. And that's why, like about 2 years ago, I've been like toying around if I want to like repost it. I made a post 2 years ago of when I decided to get a fertility workup at a local fertility clinic because I was like, well, I have to lead by example, right? And because I wanted my clients and my followers to also see that there's someone that looks like them that's actually going to go and do this. And I did that for that very same reason. I mean, I'm a perinatal mental health clinician and I'm working amongst doulas, lactation counselors, physical therapists that specialize in pelvic floor that are talking about women having like these pretty dire pelvic floor issues, and midwives and OBs. And I'm hearing these statistics, and I definitely, the common thread that I kept hearing in my clients were, hey, if I knew about this, then I would have moved differently. If I knew about this, I would have moved, this way or that way. And thank you for asking about the Black maternal mortality crisis and how it relates to maternal mental health because it is traumatizing. It does impact help seeking behaviors. But also, because I see this, I'm actually, my accreditation is pending. So I'm waiting from ASWB and NBCC. I have made a continuing education training on Black maternal mental health and the Black maternal health crises. So I really want to talk about the correlation of that. And I'm contemplating getting it credentialed by Donia because I really want birth workers in the space too. And I think that that's also another thing that also contributes to maternal mortality is there are birth workers that do not believe in mental health. And we also need to talk about that. Like, there are nurses that haven't gone to psychiatric rotations in nursing school, but they have approval to just dispense Zoloft, right? Zoloft is like the most recommended antidepressant in pregnancy for perinatal mood anxiety disorders. But like, what is that? What, like when you're dispensing this, but you don't have any education on perinatal mood and anxiety disorders? And that's the reason why if I have clients, big if, because one of the stigmas is, oh my gosh, you're going to refer me to the doctor. If I have a client that meets the criteria to need further evaluation by a psychiatrist, I refer as a perinatal mental health therapist to a reproductive psychiatrist or a reproductive psychiatric nurse practitioner. I do not refer to general psychiatrists for psychiatric evaluation because they're not, a lot of them are not trained in perinatal mood anxiety disorders or in the realm of when a woman is trying to conceive and is also undergoing fertility treatments. And again, those are all the things that contribute to those maternal mortality rates because you have people that sometimes that are getting prescribed medicine from people that haven't been trained in this realm, or um, they're being seen by individuals that do not believe in perinatal mood anxiety disorders. I've met a lot of doulas that embrace perinatal mental health. They're like, they champion it. I've also met some nurse practitioners and midwives that embrace it. But I've met some of color that do not believe in depression. And they've said things in very public statements, in very public spaces, that they don't believe that depression exists. They believe that depression is situational. And that's really scary because that also prevents people from coming to us and getting the help that they need if this is who your birth workers are. All those things contribute. Like, it's so multi-layered.
Yeah, yeah. I didn't even know that there was a thing as reproductive psychiatrist. I just learned something today.
I
That's
was literally thinking that is amazing that you said that because that's going to help a lot of therapists that are referring.
right, right. So, what we, you're talking a lot about empowering women and the advocacy, for folks, right? When they are having a baby, when they're pregnant, when post pregnancy. can you give us maybe some tips on how these individuals can advocate for themselves? I know that having a doula, that's one way, but if they've just found out they're pregnant, they're about to embark on this journey, what is it that they need to know about how they can advocate for themselves?
Awesome. So there's something called the Edinburgh Postnatal Depression Screen, EPDS for short. You can Google it and self-administer it for free. And if you see a scoring there that just sticks out to you, you can begin to start your search for a perinatal mental health clinician. There are directories like the Postpartum Support International National Directory for Perinatal Mental Health Clinicians. So you can seek out one there, and then sometimes different states have their own perinatal mental health directories. I know the DMV does. We have the DMV Perinatal Mental Health Resource Guide, that's virtual. I mean, it's online, that people can use. The other thing that I can also say too is some health insurances, like some of my clients that have some of their plans within Care First Blue Cross Blue Shield, they will Care First Blue Cross Blue Shield with some of their plans, not all. They'll waive the copay for like up to 4 therapy sessions for a diagnosis of postpartum depression. Um, so I wanted to share that because knowledge is power. And so one of the things that a person can do is just like, okay, just say to someone, hey, I would like to get a postpartum depression screening, and check in with your insurance, and you might be able to get that done free of charge. So that is one way you can advocate. And then also, um, there's a couple of other suggestions. One, I would also suggest that you can look at some support groups, postpartum support, international support groups. My other favorite resource is Seleni Institute, Seleni. They're based out in New York. They do in person, but they also do a lot of virtual trainings as well. And so that's one way I can say to empower yourself is knowledge. Get that knowledge. Um, get that knowledge, get that support, and once you get that information, I mean, it's up to you what you decide to do with it. And that's pretty much what oh, and then also, I always say this, like, make sure that you are also doing a good job of vetting the individuals that you choose to disclose this to. One of the biggest mistakes that I see serving this population is the general belief that, like, oh, you're a mom so you understand. All women do not experience pregnancy the same. All women do not experience motherhood the same. All women do not come into motherhood the same. All women do not have the same support systems. And so I often see sometimes people will make that assumption, and they sometimes will disclose to maybe the not most trusting individuals. Um, but also to understand too, like, just because somebody has gone through it doesn't necessarily mean that, like, that's therapy for you. Cause like sometimes the advice that your friend's therapist gave them kind of is like medicine. You wouldn't take the medicine that your friend's been prescribed. It can be harmful to you. So what may be helpful to your friend from your friend's therapist can be potentially harmful to you. So one way that I would say to advocate is connect with a therapist. And Postpartum Support International now has the nation's first maternal mental health helpline. It's 24/7, and you can call and speak to a trained perinatal mental health. It's a PMHC professional, 24/7, and they can help link you up to different resources. So it's not therapy, and it's nationwide.
That's really awesome. We appreciate you for sharing all of those resources, because that's something, like you said, when you have the knowledge, then you do feel more empowered, right? If I had just known, then I would have went through this and approached this differently. So we're going to move into some of our standard questions, and I think you just talked about it a little bit. But why do you think therapy is dope?
Um, I think therapy is dope because I get to support people through all of their life transitions, and everybody doesn't have the gift, the patience, and the passion to do it. And I mean, I get to help change lives for a living. Everybody doesn't get to do that. And so that's why I think that therapy is dope. Like, I help change lives, and I also contribute directly to the community that I live in. I mean, what's better than that?
Yes, and I think that also kind of speaks to our next question of why you're a dope therapist. And I first want to say, I would say you're a dope therapist because it is clear the passion
I'm
that you
sorry, I
have for
lost you all
this.
for a
It
second
is
there.
okay. I'll start back again. Can you hear us?
I'm s- yes,
Okay.
I'm sorry.
So that kind okay, no worries. Okay, so that kind of answers our next question about why you're a dope therapist. But what I would say is, as I'm listening to you, and I would say part of what I'm noticing is your passion for what it is that you do. But why do you think you're a dope therapist?
um I'll say this. Maybe I'll this will be my quote humble brag, but it's not so humble from bragging, right? So I think that I'm a dope therapist for the fact that I've
We don't need you to be
created
humble. We want you
current
to brag.
I've created currently DC's only Black therapist ran and owned perinatal mental health practice. So even here, even though we have all these wonderful HBCUs in
Wow.
existence, I'm really creating a resource that my community didn't have. And I think that that's just what makes me dope. I think what also makes me a dope therapist is that I specifically partner with HBCUs, and I provide graduate student internships to graduate students in counseling psychology programs at my sites, so we can have a larger number of Black perinatal mental health clinicians. And I have successfully supervised three, no, four to licensure now, like from internship into licensure. And so one of them is speaking about going into private practice. Another one works with a local Black lactation collective in Baltimore. And so I think that that's why I'm dope. I'm literally creating a community, both like within direct service and within academia, to make sure that we can create access for all Black birthing women to have perinatal mental health care.
I love that. I love that. You are setting the trend, right? Like, and I personally can't wait to take this training that you are developing, cuz that sounds like something that all clinicians really should know.
Yes,
Yeah.
yes. I love it. I think you're 100% correct. Everything you just said is so dope. And I love how you are like on the ground, making sure that you are representing and that you're showing up so that other clinicians can even know that this is a field that they can go into. And that's when I saw that Elisa had reached out to you. The first thing I thought was like, Shivonne has done a great job of like niching herself, being very passionate in the area that she chose, and has made it clear what she cares about and who she works with, which is something I tell a lot of like new therapists that are going into private practice, and they always want to be generalists, right? Because they're scared to pick. And I think you've done a great job at making it very clear. We've had people reach out to us around mental health stuff. We were like, no, go to Shivonne. We don't go to Shivonne. She's the one when it comes to maternal mental health. So I think it's amazing the way that you have branded and niched to like this specific Black women in maternal mental health is amazing.
Thank you. Thank you.
You're
You are
welcome.
welcome. All
Yeah.
right. So thank you so much for joining us. If you are watching, we appreciate it. Make sure you subscribe, comment, share all the things, the YouTube video, all of the podcast audio, where you can find our podcast where you find podcasts. I don't know why I can't think today. Follow us across social media at Melanin and Mental Health, Melanin Health on Twitter, as well as check out Melanin and Mental Health to find previous podcasts, dope merchandise, and our mental health directory. Shivonne, where can everyone find you?
You can find me on Instagram at Akoma, AKOMA _COUNSELING, Akoma _counseling, and on Twitter and Facebook at Akoma Counseling.
Awesome.
Yeah. And I would say, how can they also work with you? What is your website?
So www.Acoma Counseling Concepts LLC. I mean, no, sorry. www.acomacounselingconcepts.com. So see, Ebony, you're not the only one. It's me.
Thank you, thank you, thank you.
Yes, and so we currently are accepting therapy clients. So I have an amazing team of Black perinatal mental health clinicians. Specifically, right now, I also have one that specializes in reproductive psychotherapy and is in a reproductive psychotherapy cohort. So all things fertility and trying to conceive. So there's four of us in total. Yeah.
Okay. Well,
Love
that's
it.
awesome. Well, we appreciate you, of course, for joining us. And thank you all for watching. And we'll see you next time. Bye.
Bye.